Stroke is the leading cause of adult disability and the fourth most common cause of death in Singapore. Yet most Singaporeans do not know how to recognize the symptoms of stroke. Stroke symptoms are a result of damage in the brain due to blockage of a blood vessel or bleeding into a brain. Stroke is a medical emergency and everyone should know how to recognize the symptoms of stroke and know how to respond. It is important to be able to recognize the symptoms of stroke. If you or someone you are with experiences the symptoms of stroke, it is vital that you come to hospital immediately so that early treatment can be given as soon as possible. Prompt arrival to a hospital and initiation of early treatment can prevent further damage due to stroke. Early treatment may increase the chances of a full recovery, and delay of treatment may increase the risk of long-term disability and death. Here is a simple way to recognize the symptoms of stroke. Just remember the word FAST. Each letter stands for a word that describes the symptoms of stroke and what to do. F stands for face. Ask the person to smile. Does one side of the face droop? Does the face or one eye look crooked? If so, these may be symptoms of stroke. A stands for arms. Ask the person to raise both arms. Does the person have difficulty raising one or both arms? Does one or both arms drift? If so, these may be symptoms of stroke. S stands for speech. Ask the person to speak or repeat a sentence. Are the words slurred? Is the person having difficulty or is unable to speak? Does the person have difficulty understanding you? If so, these may be symptoms of stroke. T stands for time. If any of these symptoms are present, the person may be having a stroke. Remember, stroke is a medical emergency. You must come to a hospital emergency department immediately. You should call an ambulance at 995 to ensure the person gets to a hospital as soon as possible. Note the time of onset of the symptoms, as this information will be important to your doctor and will affect treatment decisions. Other symptoms of stroke include sudden numbness of the face, arm or leg, particularly if one side of the body is affected. Sudden difficulty seeing with one or both eyes. Sudden difficulty with walking. Sudden dizziness, imbalance or incoordination. So remember FAST to recognize the symptoms of stroke. F stands for face, A stands for arms, S stands for speech, and T stands for time. And act fast if someone is experiencing these symptoms by calling an ambulance and getting them to a hospital as quickly as possible.